Welcome to the Help We Need podcast, where we explore topics that empower women and support their well-being. I'm your host, Omike Murunkeji, and today we will discuss a topic close to the hearts of many mothers or carers of young children. That is, navigating motherhood through child development stages to handling common illnesses.
But if the opposite is happening, which means that you're having temperatures, you're giving appropriate amounts of the fever medication for the child's age and weight, which you need to speak to your doctor about. But either the temperature is not coming down to normal, or the temperature comes down, 2 hours later, it's back up. Then you have to give medication again. 2 or 3 hours later, it's back up. That's something that we definitely need to assess, because it's more likely that it might be something bacterial or there might be something else going on. So fever is it's a very common thing that parents will have to deal with, and it's something that you kind of need to understand the theory behind fevers, so we don't either freak out, or we don't over medicate, or we seek help when we need to seek help when your child has a fever. So with viral infections, the way that we know things are getting better, and this is important, is that after the first day or two, you know that things are getting better when the time in between the temperatures starts to get longer, right? So let's say you gave paracetamol and you had to be giving paracetamol every 4 or 5 hours because the temperature just kept coming back. By the next day, you gave paracetamol at 8 o'clock, and by 2 o'clock, 3 o'clock, the child is still fine, and the temperature only came back at 3:30, right? So it means that you had a good number of hours where the paracetamol had worn off, but the child's temperature was still fine. So if you're managing at home, the child has runny nose, viral symptoms, and you see that the time between the temperatures is getting longer, and how high the temperature is starting to come down, then you know that the body is sorting it out, and you can probably wait a couple of days and see whether it sorts itself out, right? But if the opposite is happening, which means that you're having temperatures, you're giving appropriate amounts of the fever medication for the child's age and weight, which you need to speak to your doctor about. But either the temperature is not coming down to normal, or the temperature comes down, 2 hours later, it's back up. Then you have to give medication again. 2 or 3 hours later, it's back up. That's something that we definitely need to assess, because it's more likely that it might be something bacterial or there might be something else going on. So fever is it's a very common thing that parents will have to deal with, and it's something that you kind of need to understand the theory behind fevers, so we don't either freak out, or we don't over medicate, or we seek help when we need to seek help when your child has a fever.
Well, that's a lot you've shared. I'm learning as we go. Just the range, and just to understand that the body is responding to the viral infection, and through that's why the fever is coming up, and the body really needs to fight it. I guess I've always believed that the child has a fever, you take them to the hospital, they give the medicine, and everything goes away. So that's an interesting understanding. I think for young mothers, or mothers that are just getting into this groove of raising children for the first time, I think it would be safe to just go to the hospital, right?
Absolutely.
Maybe for mothers that are a bit more,
yes,
like they've had 2, they've had 3, they've had 4, they've already kind of understood the dynamics around this and a bit more comfortable to just wait. I would recommend for newer mothers, it's okay to just go, and probably better to be safe.
We'll explain everything to you. Yeah.
Absolutely. I'm going to take you up on certain things, right? Because you talked about antibiotics, and I know there is thinking around this, because I mean, maybe I could share my own personal experience. Like, if the child is not feeling fine, and now there's maybe associated cough or something, you get to take the child to the hospital, you expect that the child should be given antibiotics. And I know, and I'm open to you
Excuse me.
verifying this a bit more, but you know,
Yep.
sometimes you get to the point that you demand that the doctor gives antibiotics. So could you just help us understand this world of antibiotics? Like, should we be asking for antibiotics? For example, if the child has developed a cough, and I mean, we know there's a bacteria. So is it the same way we just let things slide and they don't need antibiotics? Because some doctors say it's not necessary, but then I, as a mom, will want to push and at least do a blood test, do something. So you comfort me and say it's not necessary. So could you just help our mothers out there or caregivers understand? Should they be demanding for antibiotics? How should they manage this situation?
So the issue with antibiotics is it's like a thorn in our flesh as pediatricians. Um, so antibiotics are specific medications that are directed at killing bacteria, right? So giving an antibiotics to a child who has rhinovirus, which is the cause of a common cold, is going to do nothing for the cough or the cold. But what it will do is that it is giving antibiotics when we are not treating a bacterial infection is the cause of antibiotic resistance, which means that the bacteria are like, oh, I've seen this before, and I've been able to mold myself and change myself, and now the antibiotic no longer works, right? So we have, I mean, in 50 years ago, penicillin was almost could treat most of the bacterial infections, right? And now a lot of the bacteria that we see are resistant to the regular antibiotics that we use to be able to treat or to use to kill the infection, right? So going to the hospital and demanding antibiotics is not a good idea. And doctors who actually prescribe antibiotics for viral infections is also not a good idea. Now, of course, coughing is a big one because parents will often come right now. There's so many kids who are coughing everywhere. And they're like, my child has been coughing literally for 10 days. There must be some pneumonia or something that I can do to help with the cough. Now, the cough is a very interesting thing because usually your cough, when you cough, it's because of the mucus and the secretions in your upper airways, which your body is trying to clear. So you will cough, you go like this, and you're trying to clear out the mucus, which is part of the body's natural response to trying to kill a virus, right? It's making all these, the mucus, all the antibodies and all these things. So the cough is part of the body's response, as it were, right? Now, the thing to note is that for most viral infections, what usually happens is that it starts with a runny nose, and then the child starts coughing, and then the cough starts getting worse. Usually by about day 4, day 6, that's when the cough is terrible. Viral coughs also tend to be worse at night. So the kids go to sleep. A few hours later, they start coughing. They're hacking all over the place. They sound absolutely terrible. Mornings are bad. And then during the day, it gets a little bit better. And then by evening, the cough comes back. Now, the problem with children is that they're not very good at coughing. When you're coughing, what you're trying to do is that you're trying to get enough of a mucus ball or globule so that you can either, as adults, spit it out and get rid of it, or swallow it. Now, children are not good at either of those two. So what they do is that they just keep re-coughing the same mucus that they can't seem to be able to clear, right? And it can be very dramatic. I mean, I'm not going to lie, it can be very dramatic. But it's important to note that most viral coughs last an average of 10 to 14 days. That is 2 weeks. And sometimes they can last up to 3 weeks, no matter what you do. No matter whether you give cough syrups, which are not actually recommended for children under 6 because it does nothing and it can cause problems. Viral coughs last an average of 10 to 14 days, sometimes longer. we would usually expect the cough to only start to get better once your runny nose starts to dry up, right? So you can imagine a child can get a runny nose, they will start coughing, they will cough, 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 cough. Around about 2 weeks, the cough finally starts to get better. Then they go kiss your girlfriend at nursery and they get another runny nose, and the whole thing starts again. They get a runny nose, and then the cough starts, and then it also continues for another 2.5 weeks. So literally, your child has been coughing for a month. But if we listen to the child's chest, the chest is usually clear as a whistle. There is nothing going on in the chest. It is viral. And so giving antibiotics is not going to shorten the time of the cough. It's not going to change anything. It's simply going to breed antibiotic resistance in the community, right? Now, that's not to say that all coughs are viral, right? What we are concerned when it comes to a cough, which absolutely a child needs to be seen, is if a cough is associated with fast or difficulty breathing. That is what we are concerned about, right? And this is fast breathing when the child's temperature is either down or the child is not coughing. So if you have a child who's unwell, they're coughing a little bit, because you can have a child with a pneumonia who's coughing less than a child with a viral illness and is hacking and coughing and being dramatic all over the place, but they're not breathing fast. They're running around, they're active, they're doing everything. We are far more concerned about the child who's sitting calmly, but breathing fast or breathing heavily, than the child who's coughing, but not breathing fast. Because in children, if there's something going on in your lungs, the first thing the body will do to compensate is to make you start to breathe faster, right? So it's fast breathing that we're concerned about, or a child who's breathing so fast that they're not able to eat. It's affecting their ability to be active. So it's fast breathing and something called wheezing. Now, wheezing, a lot of parents say, oh, my child is wheezing. But your child is not wheezing. Your child is having noisy breathing. They sound like piglets. That's not wheezing. That's just because of the mucus in their upper airways. Wheezing is when your airways are small and tight. It happens in children with asthma, but it also happens in younger children with some viral illnesses. And the wheezing sounds like a whistling sound. And it's almost always associated with fast breathing. So it really comes down to the fast breathing. So it's fast breathing that, or difficulty breathing, that as pediatricians, we're very concerned about, rather than how bad the cough is, right? And so really, I think that's the distinction when it comes to the different types of coughs, and the fact that most coughs are viral and they do not need antibiotics.
Okay, so we're going into a very educative lesson because I've just taken it all in, and it's so fascinating to just have you clarify and differentiate, you know, the sounds and the types and all that. So that's really very helpful. Thank you for going into so much depth to provide clarity. And again, probably just to sound it out on mothers, it's okay to just go to the hospital and check.
Yes.
Because for some of us, we may not be comfortable to try and see and wait. So that's fine. But obviously, I think you've brought the awareness that you don't have to have treatment, antibiotics for every cough. But obviously, it's helpful to let the doctors kind of speak to it. I know you talked about certain doctors giving it and certain doctors not wanting to give it. So maybe just educate yourself, have those conversations with your caregiver as to why. And if you're really pressed, then maybe have them do tests or whatever to be able to determine if the child should be given
antibiotics are required.
Antibiotics or not. So I know we're still on the topic of fever, but I do have this very interesting question. And for me, this is a bit personal because when my children were a bit little, you know, fever came in various forms. Like you could use the thermometer to see if it was high, and sometimes you use the thermometer and it wasn't high. And I noticed that in separate situations, one of my children actually convulsed, and their temperature wasn't high. And the other convulsed at some point, and their temperature was very high. So my question is, and I'm sure mothers listening in would also be keen to understand how to deal with this situation. What should we as women do, or caregivers, if our children or the words that we're looking after start to convulse? Because it can be very scary.
Very,
To be
very
honest with
scary.
you, you don't know what to do. I mean, like, oh my God, and it could be theatrical or dramatic. So maybe in terms of how should we respond to this? What would be the first response? What should we be doing?
So it's, I mean, for any mother who's seen their child convulsing, it's literally, you think your world is about to like fall on your head. It's a very, very scary time, right? And what is a convulsion? A convulsion is essentially like the rapid muscle contraction. So either uncontrollable shaking or twitching, sometimes stiffness. Oftentimes it's on both sides of the body. Sometimes it's only on one side of the body. Even some children will have a convulsion, but it doesn't look like a convulsion. They're just staring or they seem to be not responding to anything, right? And so it's a very scary situation. And there are very many different reasons for seizures or convulsions in children. But actually, the most common cause of seizures is actually, as dramatic as it looks, is actually not dangerous. And they're called febrile seizures, which means seizures are short convulsions that occur in children when they have a high temperature. So we're usually talking temperatures 39, 39.5 and above. And they typically occur in a specific age group. So usually children between the age of about 6 months to 6 years old, 5 to 6 years old. That's the age range in which these febrile seizures can occur. So if this is happening in a child younger than 6 months or older than 6 years, there's usually something else that's going on. But they are simply the body's response to a high temperature. And there's some children who will have a convulsion with a high fever and others who will not. It's really genetically determined, right? And there's no way for us to predict which child is going to have a febrile seizure. And usually they last for not too long, usually about 2 to 3 minutes, maximum maybe 5 minutes, sometimes longer. But of course, a child convulsing for 1 minute feels like 5 hours, right? And I mean, statistically, probably about 1 in about 30 to 40 children will probably have at least one febrile seizure in their lifetime. So it's something that is quite common and very scary for parents. But the best thing about it is that it's simply related to the fever. It doesn't matter what caused the fever. You could have a high
Okay.
fever from influenza. You could have a high fever from a viral infection. You could have a high fever from an ear infection. The body doesn't care. It's just the fact that the child had a high fever and had a convulsion as a response to the fever, right? The good thing about those kind of seizures is that they're brief and they actually do not cause any long-term harm. Like it's not going to cause any brain damage. It's not going to cause any long-term side effects. It's just very scary, right? But that's not the only reason for seizures in children, right? So we're actually far more concerned about seizures that happen if a child does not have a temperature, because that could mean that there's a serious problem that we need to address. So you've got some children who may have epilepsy, like so they have epileptic seizures, which is as a result of abnormal electrical activity in the brain. And you've got lots of different types of these seizures. You can also have seizures as a result of trauma or head injuries in children. Some children, you can have seizures as a result of an infection, not because of the fever, but because of an infection. So maybe meningitis, which is a severe infection in the brain, that can cause inflammation in the brain and can cause seizures. Other less common causes of seizures may have to do with electrolyte imbalances. So maybe your calcium levels are very low, or your potassium levels are, or your, your electrolytes, and there's small imbalances in the electrolytes. Sugar, so low sugar levels is a common cause of seizure in children. Exposure to toxins, some genetic conditions, can also cause seizures. Brain masses or tumors or abnormal things in the brain can also cause seizures. So we've got lots of different reasons for seizures, but the most common are probably the febrile seizures, and those are short-lived. We sort out the fever, we sort out the reason for the fever, and the child is perfectly fine. But what to do if your child has a seizure? I mean, because
Yeah.
your heart is in your mouth, and we try to stay calm, but that's obviously it's easier said than done. But if
Oh,
you have prior information about what to do if your child has a seizure, you're more likely to be able to calm down and think things through than if you had no information at all, right? So this is the importance of, platforms like this, right? So the most important thing is that we are trying to keep the child safe and prevent the child from injuring themselves, because obviously they may be shaking and moving, and if there are chairs or things around that they can hit their heads on or injure themselves while they're having the seizure, this can cause far more problems than the seizure itself, right? So the most important thing is to lay the child on the floor, preferably on their side if possible, and remove anything around that they might hit or knock themselves on, right? And you also want to loosen any tight clothes the child may have. And absolutely do not ever, ever put anything in the child's mouth. Under no circumstances should you put anything in a child's mouth when they're having a seizure. Don't shake them. Don't try to restrain them. Just lay them on the floor and wait for the seizure to stop. Most of the time, in a few minutes, it's going to stop on its own. And now this is very important. This is what we doctors like, but often you don't have the mental capacity to do it. But we need, as doctors, to know what kind of seizure it was, how long it lasted. So just trying to make a mental note of when it started and when it ended is very important. And if possible, in this day and age, it's much easier than 20 years ago. If possible, get somebody or yourself to take a video of the convulsion, right? Because it helps us. I know it seems weird, but we need to know what kind of seizure it was, right? Because you've got lots of different types. Sometimes it's a shaking, sometimes it's stiffness, sometimes it's on one side of the body or the other side. And all these things have implications as to what might be causing the fever. So if we can have either a good description of what happened, but most of the time your mind is so all over the place that you literally cannot remember your age at the time, you're not going to be able to remember exactly what was happening.
Yeah, wow, just is the child okay? That's really the most important.
Exactly. So it's a very scary time, but being able to see what type of seizure it was, and of course, important for us is to note whether the child had a high temperature at the time, right? Because that helps us figure out whether this is a more dangerous type of seizure potentially, or it's a febrile seizure, which usually, as scary as it is, does not cause, long-term problems for the child. Yeah. And it's also interesting to note that the children who have had one febrile seizure are slightly more likely to have another one. So, yeah. So, and really, there's nothing much we can do to prevent them. I mean, we do try to manage the temperatures so they don't get too high, and people say that that's going to prevent the child from getting a febrile seizure. But I mean, the bad news about febrile seizures is that if it's going to happen, actually, it's going to happen. But the good news is that it's short-lived and it's not dangerous for the child, thankfully.
Oh, that's a lot you put out there. It's the most scariest, if I could say,
It's
it's the
very
most
scary.
yeah, it's the most scariest because you don't want to see it, but well, it's good to know that it's not as alarming as anticipated or thought of. So I think the most important thing is knowledge. Knowledge is empowering, and obviously you've said it so well. That's why we're having these types of platforms to empower women and caregivers so they know what to do. If
Mhm.
they experience it, then they know what to do. And you're correct. In times past, there's a tendency to put a spoon in the mouth, and like if it gnashes the teeth, the child may die and stuff like that. And those
They
things
might
have
choke,
obviously,
they might, it's very dangerous. Yeah.
yeah, we don't do that. So please don't do that. And try to loosen tight clothing. As I hear you say, keep them away from trashing and hurting themselves. If you can, be very mindful so you can describe, or maybe immediately after they calm down, quickly jot down the experience before you forget. If there's
Mhm.
somebody nearby, I don't know if it's tenable to say take a video, but if you can, then maybe that's what you should do. But if you can't, then at least be able to describe, maybe take notes immediately so that you can recount as best as your memory serves you when that does happen. So thank you for providing that perspective. And I think, when our women do go, or caregivers do go to the hospital, then the caregivers or specialists will be able to do more tests, just to check
Exactly.
what it really is, and will be able to guide us from there. Because you said it rightly that there are different types of seizures, and causes to seizures obviously vary from one person to the other. So that's so good to know. Thank you so much, Dr. Eunice. Just moving on to, I think, my fifth question. And I know we talked about fevers a lot and temperature, 36, 38, and all that. Obviously, we need a thermometer to be
Yes.
able to gauge it. So the question is more around having a first aid box at home, right? We know it's helpful to have a first aid box at home, and especially for us women who have young
Mhm.
children. And we could have the first aid box at home even if we don't have young children. But to the point, for us women who do have young children, what would you advise should be in our first aid box? And
Okay, so
maybe
that's a
where should we place them? Where should we place them also? Because I would just hold on a bit and allow you talk on that, but if you could just provide some perspective, that would be helpful. Thank you.
So it does help to have certain things at home. It might not even necessarily be in a box. It might be in a cupboard or away from your children, because some children, they like the taste of, paracetamol, and you'll find them in the bathroom, sipping on some paracetamol as if it's juice. So it's very important just to make sure that wherever you keep your first aid items, that it's somewhere safe, somewhere high up, maybe where your children cannot reach it. So that's important. Before I talk about the first aid box, I should also just mention that, we talked about certain things, when to go and see your doctor. So one is that if you have a fever in a child less than 3 months old, and it's not related to like they've had a vaccine in the previous 24 hours, you absolutely need to see your doctor. We talked about the fever medication, which we're going to talk about in our first aid box. But if you find that your child the fever is not responding to the fever medication that you're going to give, like, so either the temperature is not coming down at all, coming down, or coming back up very quickly, that's another reason. Of course, we talked about the fast breathing and the difficulty breathing. Sometimes your nostrils will be flaring and all that. You definitely need to see your doctor. If your child has been vomiting or having diarrhea, they become very weak. That's also a very important sign. If your child has a seizure, you probably want to see your doctor. Or if your child has things like pain when they're peeing, or they're excessively drowsy, in those situations, you're not really gonna be doing too much of the first aid. You're gonna want to, take your child to the doctor, right? So in your first aid box, as we've talked about, one of the things that almost all parents have would be pain and fever relief, right? So we're talking about things like paracetamol, or acetaminophen, which is a long name for paracetamol. And you've got lots of different strengths, and you've got different brands. So you need to be sure that you've spoken to your doctor to get the right amount for your child, because you could have different strengths, and one child could have 1 mil of one strength, 2.5 mil of another strength, 5 mil of another strength. So you need to know, because we base our treatment on the child's age and, more importantly, the child's weight. So this is something that you need to see your doctor about, so you know that you're giving the right amount in the right frequency. So paracetamol, Brufen or ibuprofen, which tends to work a little better for the much higher temperatures. So, and they are for fever, and they're also for pain relief, right? So you might be giving it more for pain relief than maybe your child has hurt their ankle or has twisted their wrist, but it's not broken or something like that. And you're giving it for pain relief, but not necessarily for fever. So that's very important. And then, of course, children hurt themselves all the time. I mean, you have boys, so you know all about that. You know, all the cuts and the scrapes and the burns and all that stuff. So you need to have things for basic wound care. So bandages, plasters, gauze for different types of wounds. Sometimes it helps to have like an antibiotic ointment in your little arsenal. For things like burns, rashes, we've got certain, like sometimes we use low dose steroid creams or like gels that help with skin irritation or burns. So you can speak to your doctor about if that's appropriate for you to have in your at home. For some children who either have allergies or they have like eczema or itchy conditions, sometimes giving an oral antihistamine is important for especially those who have allergic reactions to either foods or something like that. If your child does have an allergy, obviously you need to confirm it, because sometimes you think your child has an allergy, but it's not. So children who have severe allergies, we would usually give them an EpiPen, but that's something that it's an adrenaline for a severe allergic reaction, but that's something obviously that your doctor will prescribe for you. And then for those children who are at risk, they have that at home, they have it at school, they have it in their, school bag. So allergy, like oral antihistamines for allergies is also probably something to have at home. And then of course, a good thermometer that works, because sometimes the thermometer is a little off. We do like the ear thermometers because they tend to be a little bit more accurate and give a bit faster readings than the, the underarm thermometers, which take a bit longer. So the digital thermometers are, especially the ear thermometers, are probably a good one, to have in your first aid box. And then the other little things like saline solutions or like antiseptic solution for wounds and that sort of thing. Of course, we all have like nail clippers and things. Babies, they like to scratch themselves, because their nails grow very quickly. So yeah, that's probably some of the main things that you should have available if you have children in your household.
Thank
Helps
you.
for adults also.
Yeah, and I think also maybe to call this out as well is trying to keep a list of emergency numbers. And maybe
Yes.
put that where you can easily access it,
Yeah,
or
absolutely.
that would be helpful, because I think sometimes when emergencies happen, the brain just goes blank.
Everything leaves.
Momentarily, and you remember,
You
like,
lose
seriously,
everything.
your own phone number sometimes.
You
So
don't know your name
just
sometimes.
yeah, that's true. So just having those emergency numbers. I mean, if we do have a box, like first aid box, we can paste it in there or somewhere accessible. I think that also would be helpful. And thank you so much, Dr. Eunice, for just providing so much perspective. So for our women caregivers out there listening in on this podcast, so please, it's very important to have a first aid box or a medicine cabinet, but also more important, to keep them away from your children. I've had my boys get very creative, climbing stools.
Yes.
So because they see you put it there, right? They just pretend
Mm-hmm.
like they don't.
Mm-hmm.
And then they help each other out in terms
Mm-hmm.
of how to hold the stool, and someone else climbs it. because they feel like that's tasty, let's have
Yes.
some. So just very important for us women or caregivers out there to keep it completely out of reach,
Right.
including stools, right? So that we don't get into an emergency.
Yeah.
So I'll just move on to this question. And to be honest, Dr. Eunice, I've struggled with this question myself. And it is, should mothers of young children, should we be going to the hospital to see a general doctor? We often refer to those type of doctors as a GP. Or
Mhm.
should we be asking to see a pediatrician like yourself, whose
Mhm.
specialty obviously is in childcare? I mean, is there a difference, or should we be particular about a type of doctor? And I
Mhm.
know because it's a global platform, some of us caregivers or mothers may not necessarily have access to a pediatrician and it's just a GP. So
Mhm.
should we be worried about the type of care provided? I mean, could you just help us unpack this one? Because personally, I have struggled to like which is which, and am I doing the right thing by seeing this type of doctor instead of that type of doctor? So could you just help us quickly broaden that out a bit?
So this is a very good question, actually. I think it's important to note that, in medical school, we go through everything, right? So you do a bit of surgery, you do a bit of obs and gynae, you do medicine, you do all sorts of things. So generally, doctors have a decent amount of knowledge on a wide range of topics, including looking after children, right? Now, general practitioners often have extra training in, because they've gone through different modules and they have worked in different environments where they have had to look after children. So some GPs are actually fantastic at managing the common conditions in children because they're trained to do that, right? You also have family medicine doctors who are specifically trained in pediatrics, in adult medicine. And so they actually are also very well prepared and capable of looking after children, especially for the basic things that the majority of children will deal with. And then of course you've got pediatricians who are, we look only after children because we like children. And you've got even subspecialties of pediatrics, right? So, and of course, it depends on which doctors are available in your environment or in your city, right? And so you want to find a doctor, whether it's a GP, whether it's a, medical officer, whether it's a family medicine or internal medicine, whether it's a pediatrician who is comfortable with and is confident in looking after children, right? Because a lot of them are, and it's quite easy to find out. You can ask questions when you call. You'll be like, oh, is this a doctor who sees both children and adults, or just adults, or mainly children? So just so that you can have a bit of a gauge as to what their competencies are, right? And of course, choosing a doctor, it's a very personal thing. You could have two very good pediatricians and you just gel with one more than you do with the other. So you just seem to be more comfortable with one person than the other. It's just, it is what it is, right? So it's important to find a doctor that you are comfortable with, who you trust, and who is competent in looking after children. They don't necessarily have to only look after children.
Okay.
And a lot of the things that we see on a daily basis, even very junior doctors are very well equipped to manage and to identify, oh, this child might have a bacterial infection, this child has this. They'll look in the ears, they'll check. And this is training that, we all have to go through. So a lot of, in some places, they only go to see the GP, and only if there's a serious issue, they may be referred to a pediatrician. In some places,
Mhm.
they will go straight to the pediatrician. They don't want to see a GP at all. In some places, it really varies from place to place. But doctors do have a wide range. Like, you don't have to be a pediatrician to be competent to look after children. especially for the typical things that we see in children.
Well, thank you. That really helps, to be honest. And I think one thing that you've called out is ask the right questions, so that if the doctor is comfortable and if they do take care of young children, they will let you know. And obviously, you've talked about the decision being personal. So if you're comfortable with a particular doctor and they're competent to take care of your child, then that's the way to go. So that's really helpful, because to be honest, previously, there used to be a lot of confusion, especially on that regard. You've even thrown in the family medicine, because I just
Yes.
asked GP and pediatrician. So
Yes.
those questions would help us as mothers or caregivers to be able to identify or be able to like, okay, then this I'm comfortable with. And we can also explore and see different types. And then we decide which we feel is much more convenient or we feel that we're comfortable with.
For your
Maybe that's
family.
also exactly to
Absolutely.
look at it. So this has been an amazing time. Honestly, I have learned so much from you. Thank you for just being so your lovely self always, but just being so very explanatory and just giving us perspective in terms of all the questions that I've posed to you today. And I think it's really very helpful. And I believe our listeners on the podcast obviously feel the same.
One thing I would definitely like to end with is just to say to all mothers and caregivers out there that you are really doing a fantastic and incredible job, and that raising and looking after children is something that is not an easy task, but it really is very rewarding. And it's important to know that there are people, there are professionals, there are family members and people out there to support you on this journey, and that it's okay to ask questions, to seek help and support where you need it. And as pediatricians, we are always here to answer your questions and to help you to look after your child so that your child can really be the best that they can be and reach their full potentials. So I think that's what I have to say.
Thank you so much, Dr. Eunice. Your guidance and helpful tips have been really, really vital, if you allow me use the word. And I trust that our mothers and caregivers listening in on the podcast today are finding it very relevant to their childcare needs. So dear listeners, please remember that you are not alone on this journey. Trust yourself, stay informed, and don't hesitate to reach out for help. Your child's health and development are a priority, but so is your well-being. Thank you for tuning in and listening to the Help We Need podcast. Stay tuned for more episodes on living your best lives. Until next time, stay empowered and remember to empower her.